Hi, this is a patient testimonial from Richard on the HemiCAP shoulder resurfacing system. I am Michael J. Greller, MD, a board-certified, fellowship-trained orthopedic surgeon in sports medicine. I am also the Assistant Director of the Cartilage Restoration Center of New Jersey. Hello, I'm here with Richard Tillman. Richard has been a patient of mine for about 5 years. I'm Dr. Greller. Richard, how did you present to me?
I had found you through a referral from a friend of mine who had traumatic ankle injury. You did very well with her.
And what were your complaints when you first came to me? What were you experiencing?
I had a lot of pain in my shoulder. I had abused it with some extreme sports, dislocated it, and done some damage that I ignored for a long time.
So we've done multiple procedures. The first procedure, if I recall, was the shoulder arthroscopy on you. And at that time, Richard was found to have cartilage damage of his shoulder. And we were just getting into the realm of cartilage transplants and replacements. And I had talked to you about a novel procedure which was called the HemiCAP, which was where we would take a thumbtack type of piece of metal and replace cartilage rather than doing the traditional shoulder replacement. So you did well. Initially, you had that surgery done. We did it at Central State Medical Center, if I recall.
That's correct.
And how did you do after surgery? What did you experience?
It was a lot better than before surgery.
Okay, so you saw an immediate decrease in your pain?
Absolutely.
And you eventually did rehabilitation.
Mm-hmm.
Where did you do rehabilitation?
We did rehab right here.
Okay, so you did an advanced physical therapy or Freehold, which is a physician-directed rehabilitation center that's part of the Advanced Orthopedics and Sports Medicine Institute. After you went through your rehabilitation, your pain scores, how would you say they are on a daily basis now that it's 5 years later, almost 4.5 years later, compared to back then?
There's a lot less pain than there was initially.
Okay.
I have a lot more use of my shoulder and my arms.
Richard had a defect here in the humeral head. A piece of cartilage was lost. So rather than traditional method where we replace the entire shoulder, we put in a small metal thing that looks actually like a thumbtack piece of metal in to replace the lost cartilage, rather than traditional total shoulder replacement or partial shoulder replacement where we replace the entire humeral head. So if you look at a model, what we did is we went in there and put a little thumbtack of metal in his bone. These are arthroscopic pictures of what cartilage loss looks inside the shoulder, similar to Richard's. This is what a HemiCAP looks like. Notice the smooth head. This shows how a HemiCAP looks once inserted. These are Richard's x-rays. Before is on the left and then after surgery with the HemiCAP inserted is on the right. The advantage of this is that we did a tissue sparing, bone sparing procedure so that it doesn't close any doors for him in the future. So if you need another procedure, there is something. And you haven't burned any bridges. So as we know, shoulder replacement, knee replacements, hip replacements have a limited life. You still have all those options open, and we've discussed those in the future.
Absolutely.
Is there anything you would have done differently?
No, actually, I think that my quality of life has improved greatly prior to the surgery. I'm glad I didn't go forward with a total shoulder replacement at this point in my life. I'm still young enough to make use of what you've done for me. And, I go through my daily routine as if, nothing's happened.
Richard will tell us about his experience at Advanced Orthopedics and Sports Medicine Institute in Freehold, New Jersey. Talking a little about your experience. How was your experience dealing with Western Monmouth and Advanced Orthopedics and Sports Medicine Institute?
Oh, it's been great. You guys have always been very forthcoming with information, and I went into this with my eyes open because of that. I'm very pleased with the way your staff treats me, and the facilities are awesome. Even the physical therapy part of it, very good people over there that are very good to work with. A brief physical examination after Richard's HemiCAP shoulder resurfacing procedure. I want to show everyone some of your motion. So Richard had this is a cartilage sparing procedure, but it's still considered a partial shoulder replacement in the shoulder replacement world. Can you show me how you move your arms? So Richard can get it all the way up, okay? Can you bring it out to the side? Can you hold it up for me, show you how strong you are? You can hold it, that's pretty good strength. Can you show me how you move this direction? This is going to be the hardest one. This is okay.
That's good. And the one thing that he does have is probably behind the back is the hardest, but daily life, if I asked you to get up into the cabinet, you can go do it.
No problem.
You can drive a car, you can play with your kids.
I can lift things and and do everything. I ride my motorcycle. I still ski, which is what initiated the issue.
I remember the water
And
skiing
the
accident.
jet skiing, yeah.
Jet skiing
yeah.
accident. All right,
Yeah.
well, I appreciate you coming